Hello and welcome to our presentation. You're going to see three case studies. One of Willem de Kooning, American abstract artist, and his journey with Alzheimer's. The second, Dr. Zarina Lam's pilot study in Hong Kong, the changes that Alzheimer's patients went through using the Neuro-Art Therapy Kit. And the third of a stroke survivor's recovery using the Neuro-Art Therapy Kit. In this painting, we begin to see that Willem de Kooning uses art as a very intellectual process. We can see here that the artist works with realism. The use of colors and design appears complicated, yet the sky is easy for us to comprehend that it is a sky. And two, the artist challenges us to find intellectually, what does he mean by its title, Legend and Fact? This work of art is called Untitled. It was done in 1950 when de Kooning was 46 years old. Here, de Kooning's composition of design consists of positive space, negative space, and focal point. The composition of design is used in an abstract and intellectually very complex manner. To me, he's having fun here, showing us how he can make it work. He balances it out with a place for your eye to rest, and he also makes it more complicated on the left side low and the right side high. Here we see a painting, possibly a pastel piece of work, and de Kooning shows us a little of his humor. He calls this Study for Woman Number 1. 1952 he produced this, and he was 48 years old. He's still using the composition of design. The focal point is clear, your eyes drawn right into the chest area and then up to the face. He's using some of Picasso's style here with distortion of shapes and the figure. But we can clearly see his humor. This piece of artwork titled Composition was done in 1955. De Kooning was 51 years old. Here we see him using mixed medium of oil, enamel, and charcoal on canvas. The artist is using complex design, and he is having a lot of fun here. He uses many values as mechanisms to pull the viewer into his painting to search for meaning. This is a finely done piece of artwork, and clearly he had a nice outline of design in which he played. A Tree in Naples, 1960. De Kooning was 56 years old. While this may seem a strange interpretation for a tree from Naples, I can see de Kooning's humor in here. I see the way he plays with dimension. In the lower right hand corner, it looks like a flat seat. To the left of that, it goes down and kind of looks like it's a V in the lower right hand corner, which represents a chair. The above that is flat. So de Kooning here is saying, let me see if you can see what I'm doing in here. I'll call it a tree in Naples, and I'll make it a little complicated for you. And I can just picture him having a smirk on his face when he completes this painting. Now something very interesting happens here. This is again Untitled 1969, and de Kooning was 65 years old. The work, while it still has a sense of composition, is all very flat, and it's weak and appears unclear. It's not as well defined as his other work. The title of this is Woman at Clearwater Beach. It was done in 1970, and de Kooning was 66 years old. Around his early 70s, de Kooning was diagnosed with Alzheimer's disease. And in this charcoal piece of artwork, you can see his anger and his emotional state overpower his composition. One has to wonder if the Alzheimer's was not setting in, and de Kooning may be unconscious of what's happening here or unaware of it, and is expressing his anger of the changes. Minnie Mouse is the title of this piece of artwork, and 1971, de Kooning is 67. Again, his work seems all mesh together. I can see a face of what appears to be Minnie Mouse in the center here, and on the bottom left to right there are what appears to be woman's high heels. So while de Kooning still had an ability to produce his artwork, it appears highly frustrated and agitated and very confused, not as clear and as intellectually presented as his previous. We're now looking at a piece of artwork called Pirate. It was done in 1981, and de Kooning was 77 years old here. Now keep in mind, this is 11 years after he was diagnosed with Alzheimer's disease. Now if you look what the curator from the Museum of Modern Art was saying here, variously spare, animated, and richly hued, these paintings demonstrate a striking formal and emotional range. Presented together for the first time, they are crowning achievement of one of the greatest modern painters. Now, there's an interesting story that goes along with this that I want to share with you. While I was researching de Kooning's work, I was also being interviewed by a Canadian news reporter. I had mentioned this remark made by the curator from the Museum of Modern Art in New York, and the reporter laughed and said, yes, I spoke with the curator, and he said that they were laughing at de Kooning's work and they were trying to make him feel good by giving him the show and saying these kind remarks. However, what they didn't know is that in order for de Kooning to produce this art, he had to have aides pour the paint onto a palette. He had gone through a rigorous recovery period with his wife, hiring these aides and giving de Kooning proper diet, exercise. He withdrew from alcohol and cigarettes. And I think you're going to see something very, very interesting here as we progress into de Kooning's work. Now remember, this is the first one he did after Minnie Mouse that I could find, where he was diagnosed with Alzheimer's. So now the gentleman still has Alzheimer's, but he's going through a progress period with recovery using the arts. Now look at this work. It's the one of the series that the curator spoke of with de Kooning. You can surely see here where de Kooning is regaining some of his strength and line and design. However, it's not as intellectually produced as his earlier work, but yet he seems to be getting a sense of flow, and his style has changed. He's using primary colors, and yet one would have to realize that in order to do these things, he has to be able to make better decisions about line and their connection and integration as a whole. So study the next painting, and I'll be back with some further comments. Here we can see de Kooning and his earlier works where he became rather vague with his composition. And on the right we can see the strength that emerged at 81 years old. Quite a remarkable accomplishment, I would say. Now, for the next several slides, I'd like you to read what some very accomplished professionals had to say about art and cognition and using art as a possible therapy for Alzheimer's clients. And I'll return after you read the next several slides. We're now going to be looking at a study, a pilot study that was done in Hong Kong by one of the graduates of the Del Giacco's Art Therapy course. Her name is Dr. Zarina Lam, and you will be seeing a little bit about how she got people who had severe dementia and an aversion to be social to work together and to actually help one another within a very short time using the Neuro-Art Therapy kit. In her pilot study, Dr. Zarina Lam used the Neuro-Art Therapy Drawing Series. There were 5 clients who had severe cognitive deficits, and they were reluctant to take part in social activities. Now, I have provided you with Dr. Lam's pilot study with this CD, so please be sure to review it after you've watched my presentation. As you look at this design, it looks rather simple in nature. But for someone who has dementia, trying to make shapes sensible, and it is sensible because they're copying the shape that they see from the Neuro-Art Therapy kit and their forms, and you saw the hard time that de Kooning had with forms and the anger that he had. Here, these designs can help the client to relax, to become focused, and to regain their attention. This is not a cure-all, but it certainly does become a focal point where people can begin to come outside of their dementia, if you will, and begin to interact with one another. Focusing, for some reason, is very difficult for people who have cognitive problems, and you will discover more of that reason as we go on in class. You know that color helps people to be more comfortable when working and to feel relaxed. That's some of it. And you should also learn from this course that line and design are actually the prerequisites to attention. They are the primary decoding form that one needs to really access higher thinking. And while the brain works together all as one, we have to have primary systems working at a decoding level in order to gain our concentration. Next, you're going to be seeing a story, a rather remarkable story, of a client who had many problems when she came to see me. She recovered beginning using the Neuro-Art Therapy Kit to help strengthen the decoding processes of her brain, and then moved on to create scenes and wonderful artwork, which she still does today. Go on now and read some of what she encountered through her stroke and when we met one another. Here you can see an example of the neglect syndrome, both left and right, or known as bilateral neglect. What this syndrome is sensory deprivation. It usually happens on the left side of the brain, but in this case, her stroke manifested on both sides of her brain, and therefore you would get a projection of a drawing of the lines, central line in the clock where she writes 12, 1, 2, 3, 4, 5, and 6. And she sort of knows that that's not right, but she's not aware of how to change that. And she creates a little circle to the left lower corner here. And she tries to correct that, and she actually puts the 1 and 2 on the right side, but then she said, I can't. So even though she was trying to correct that, she didn't have the ability, the pathways to accommodate that correction. And you'll find that neglect discussed in the advanced course more. Here's one of the beginning exercises I gave this woman. Remember, she's 70-something years old, 76 I believe, on intake. And what I did was I had her copy one of the exercises from the Neuro-Art Therapy Drawing Series. And I had her tell me what shape it was. Is this a circle? Is this a triangle? Is this a rectangle? And next I asked her, would you write the color that you would like this to be, but only write the first letter of that color inside of the shape. And what that does is, it, number one, gets you connected with the shape, which is dimensional analysis, or the first part of attention. Actually, the first part of attention is sensory information, because we can have no attention without proper sensory information. But the part that really is important to this course is the dimensional analysis mechanism prior to the cognitive functioning. So that's what we're working on here, working on the decoding and the early process mechanism of attention, which is the decoding dimensional analysis. Now something interesting happens here. She begins to draw a tree. There are nice bright colors inside that tree. There's a bike there. There are stones there. She's actually beginning to move from both sides of the paper now. If you can see, there was a strong line underneath the rocks in the tree and the bike, which is brown. While she did put other things on other sides of the paper, right and left sides of the paper, I had to encourage her to do that, and I also encouraged her to extend the brown line out, and you can see she did it with purple on the right and on the left. So it was after she put those things there that she put the lines there as well. She titles this Me, and it's a very interesting title because it's here that she begins to understand things in her environment again, which tells me that pathways are beginning to open up on right and left side of her brain. As we continue to work opening the right and left sides of her brain, the woman was instructed to paint the paper first, and she would often start on the right side and move to the left side, and then from the left side to the right side. And of course this is trying to give the eyes movement and also to get the color stimulating both sides of the page in her brain at the same time. Now this lady had paralysis in her right hand, and I am the one who is in charge of dipping the brush, cleaning the brush, putting the paint on it, and then she paints. She has a very nice stroke. It's very short and direct, and you'll see that continued throughout the work that she does. But this was another beginning stage of where we're trying to work on removing or correcting the neglect syndrome. This is another painting that we worked on, and again we're working on shapes. Remember that the coding is the primary part or mechanism for attention. As we began to open pathways, I again had her make shapes from left to right side of the page, and this time I cut out different shapes for her, and I asked her to take the shapes and lay them on the paper where she would like them. We also, in this exercise, had her write numbers because I'm working both bottoms up, sensory, and top down, which is cognition. In writing the numbers, she's connecting to her cognitive functioning. So she wrote the numbers, and I also cut out these numbers, and I asked her to place them on the paper where she'd like them to be. And she was able to place them on both sides of the paper, and she enjoyed doing this exercise very much. Now here's a very pretty painting that she began to do. It was this one day she began to take form and things began to have strength. Very much like de Kooning, and remember, de Kooning had Alzheimer's and this lady has a stroke, so you have to wonder if there's some type of connection in their regaining their strength. This painting, she's clearly on right and left side of the page. I thought that this looked like an aquarium, so I took part of the page and cut out the sides and made it look more fluid. Out of the side cuttings, I made a little fish, which you can see in the bottom, and it looked like an aquarium, and she kind of really got a kick out of that, so that was very pleasurable for her. Here we had stopped working with the Neuro-Art therapy shapes, and she was just free-handedly painting, and you can see every piece of this paper is covered. Now the forms are kind of not defined, and yet they are having some shape and definition. And I thought, wouldn't it be interesting to go back to the shapes and see if we can't really regenerate the attention mechanism so she becomes more focused with this. And that's exactly what we did. Now you can see the difference after we did the Neuro-Art therapy exercise, which was the last slide you saw. This is the painting she did 1 week later, and it had this similar theme, but the flowers are much more defined. The only part that I did in this painting was I put the vine and I made the leaves for her, which she helped. But all the flowers are hers, and I added some little things inside the flowers, but all the flowers are very much hers, and she did every part of that herself. Quite remarkable from her earlier work. Also interesting to note is that she's been reading. She wasn't able to read before. How could she read with bilateral neglect? She reads for an hour, half an hour to an hour at a time. She was sent to a behavioral optometrist, and he gave her special glasses. The type of reading she's doing is large print from Reader's Digest books. She understands what she reads, and when she's not tired, she can pretty much tell you about the story. She will always struggle with memory because of the damage is so severe, but she does have periods when she's rested that she can really think pretty good, and she's very sharp. She's a great lady. Here's a message from the client. You can read it below. And I'm going to be leaving this presentation for now. I have enjoyed bringing this to you, and the next few slides after this lady's statement will get you more familiar with the Neuro-Art Therapy Kit, what it can do, what it has demonstrated to do, and how to order one if you like, and also where to find more resources. I just want to tell you that I really have enjoyed putting this work together, and if I can be of any further assistance to you, please do not hesitate to contact me. Thank you.